Welcome to All Things Chiropractic.
Well, welcome to another episode of All Things Chiropractic. I'm Paul Andrews.
And I'm Dr. Mark Davini.
We are excited because today we have two, not just one, but two special guests. We have Dr. Christopher Proulx and we have Jacob Currier from MedCor. Hi, guys.
Hello.
Hey, good
How's it going,
afternoon.
guys?
So we're excited to have you, not just because they are providing us awesome education in the month of March this year. We'll get into that. But first, I wanted to dig in because we are all things chiropractic. We always like to ask our guests, let's start with Dr. Proulx, what made you want to become a chiropractor?
Oh,
I
man.
thought you said I had to keep it 2 minutes or less.
Yeah. Well, I figured that will introduce yourself. If you tell us how you got into this journey of chiropractic.
Start at the beginning. Yeah.
So
Careful what you wish for. The man's
I was
long-winded.
born in 1960. No, so I started undergraduate as sort of I was pre-med, I was a chemistry major and wanted to go and be an orthopedic surgeon. And I actually got more into fitness and changed my major because I was like, wow, I think there's a great opportunity for me to make a difference, without doing surgery and nothing against surgery because it's been a wonderful, technological advancement in health. And then, so I was also thinking kind of physical therapy, and I worked as an exercise physiologist in a PT clinic. And while doing that, I got back into the research thing and I was interested in research. So I was working on my master's in exercise science and I met a chiropractor. So, we had a lot of our patients that went to chiropractors. They would always come in and I grew up in a very allopathic model. And so, what I knew was just what I heard from patients like, oh, they crack and I feel great. And I keep wanting to go back. And so didn't really have a lot of information to go on. And so I met this gentleman him and his wife were both chiropractors. They moved to the town I was in. And I was also working in the fitness center where the rehab center worked. And he was doing some stuff in there and spinal screenings. And he comes up to me one day and he's like, I noticed you look at me kind of funny. I was like, no, dude, I was just,
It's just me, man.
We've had people go to chiropractors.
I guess it begs the question, do you get that a lot?
Yeah.
Well, that's what I mean today, right? I still look at people just from a different point of view, and because we do that as clinicians, right? So he's like, why don't you come in and spend the day with me in the clinic, of course. And so I did, and I had done, my sports medicine athletic training, and I was blown away because I'm like, wow, the names of your tests are very similar to the ones that I learned. And he's like, listen, he's like, yes, we may do a little different approach with regards to how we manage things. He's like, but for most purposes, when we diagnose something, it's the same way. It's just we take a more holistic approach and a more natural approach and more comprehensive in terms of that. And he did an evaluation on me. So he's like, we do the standard and then we do a chiropractic. And like, I swear I wasn't trying to get him, but I forgot to tell him something. And like, he picked up on something that otherwise I was just like, wow, that was super interesting. And I got back to grad school, and my professor for my master's, we were looking at where I was going to do my PhD. And I said, listen, I think I'm going to go on and I'm going to go to chiropractic. And he's like, what are you talking about? And he's, one of our eminent sports scientists, Dr. Mike Stone of our era. And he's like, hold on. And he goes and grabs the phone. And I'm like, you're not going to talk me out of it. He's like, just talk to this guy. And I get on the phone. I'm like, I don't know who you are, but you're not going to talk me out of it. I've done my research. And he's like, no, my name is Dr. Mike Reed. I'm director of sports medicine for the International Olympic Weightlifting Committee. And I'm also a chiropractor. Great conversation. And I hung up the phone, and Dr. Stone's kind of laughing. And he's like, listen, he's like, when we go to the Olympics, he's like, we ask our athletes, like, what do you need to be successful? And he's like, every time, number one and number two, He's like a chiropractor and a massage therapist. And he's like, by the way, did you know the overarching director of sports medicine? Because I was into a lot of sports. And he's like, is a chiropractor. And so it just really solidified that. And, to this day, and like even this new patient I started with last week is just, I'm still amazed at some of the things that, we're able to accomplish. And so are our patients, without cutting them open or using a pharmaceutical. Again, I'm not opposed to them when utilized properly, but, we have a really good opportunity to make and change the lives of so many people. And it just continues to be rewarding, 25 years later. That's
Wow.
it.
Oh,
Cool
that's a
story.
nice story.
Love it, Tom.
Very good story. Yeah.
All right. So on the
Was that
flip
was that 2
side,
minutes?
yeah,
Yeah.
yeah,
Well, I
I know.
think you used yours. So moving on.
Yeah, don't set the precedent here. So Jacob, as myself, you are non chiropractor. So
Correct.
how did you get into I would say the profession of chiropractic, but how did you get into MedCor and want to serve the chiropractic profession among others?
Yeah, so I don't know if my story is as interesting as Dr. Proulx's, but here it is nonetheless. So my background is actually in kinesiology. So I went to college at the University of Maine, born and raised Mainer up here in the north, and yeah, went for kines and absolutely loved it. So, a lot of my passion, I had a concentration in exercise science. So, a lot of interest and passion on my side was in, optimizing the human body, right? Movement, optimizing movements in the human body. That's where it kind of all started, right? So I knew that I wanted to work in the human movement, human medicine, physical medicine, type of industries. I didn't necessarily want to be the clinician though, and I found that out early. But I still had a passion for the industry, so that brought me to the business side of it, where I ended up doubling up and getting a business degree and kind of combined the two. So MedCor is a family-owned distributor that we have a few different areas that we specialize in. But when I came on board almost 7 years ago, I started up the chiropractic division here. Because before that, we really weren't working a lot with chiropractors, mostly orthopedics, surgical, physical therapy, home medical. So I kind of came in and, because obviously I had, the background in kines, and my school actually partnered with a lot of chiropractors for internships. And a close friend of mine, Dr. Patrick Healy, from my hometown, was our athletic trainer, but also a chiropractor. So I had a lot of experience shadowing him, internships with him, and some other doctors. So I knew of the industry, and I kind of had an idea that it was underserved. So that's kind of where my goal, started with MedCor was all these other industries have a lot of people helping them out, but chiropractic doesn't seem to have much. So that's kind of our overarching goal here at MedCor is, to provide good service and options, and in the case with you guys, right, education, training to chiropractors, because there's not a lot of resources out there, right? A lot of our competitors are just online dealers, and that's fine. And there's a time and a space for that. But there's also a time and a space where you need face-to-face interaction with these doctors, or at least at the minimum, a phone where they can call and you pick up consistently, you answer their questions. When a new piece of equipment goes into an office, proper training, how to implement the actual program so it's successful both for their practice, for their patients. So we really kind of take a consultative approach to this stuff. So it's long-winded spiel of I saw that it was kind of an underserved area of medicine. I always had the interest of physical medicine, so I came in wanting to just provide resources to doctors to just better, you know, all of our goals. Right, it's like better patients. Let's utilize some of these, non-pharmacological treatments to manage pain, move better, maybe avoid some surgeries, right? So I get to play a part in all the great doctors that utilize our tools to help patients.
It's interesting going through your story and listening to it. going back to my own experience, when I first started practice, we had a equipment supply company at the time. They've since been merged and purged and all of that. But I have to say, what made the difference as a young practitioner coming out knowing everything there is to know about chiropractic, of course, right, Chris? We knew everything then, right? Yeah. And not knowing a thing about running the business of chiropractic. And I have to say, the personal service of, it was Sid Kaufman and George Brown from Sidco many, many years ago. I don't know how you get through those first few years without having someone with the caring and the understanding and the technical knowledge to guide you through things that we didn't even come close to learning in school.
100%. No, it's important. A lot of chiropractors, as obviously very well, they come out of school and they go right into business, owning their own practice, right? And
Chief
that's
cook
a
and
whole new
bottle
world.
washer.
I mean,
Yeah.
that's
Yeah.
like if I opened up a sign on my house and said, "Patients, come on in, and I'm going to start treating you." I wasn't trained for that.
Yeah.
I'm trained on the business side, though, right? So it's owning a business. There's a lot to owning a business, and it's if you're 27 years old, fresh out of school, you don't really know what you're signing up for, right? And without good resources and help, man, it's hard.
Well, we have to say that it's probably the reason why we're in existence, right, Paul? I mean,
Well,
when
probably all of us here. So,
for all of the way
yeah.
back,
So
there wasn't the need.
I want to ask Dr. Chris, because you're going to do another class for us. This is on Shockwave. Now, to me, when I hear Shockwave before I saw it, I'm like, this sounds like a good action movie, like Shockwave coming.
Yeah.
You know what I mean? Like
It's an Arnold Schwarzenegger movie.
yeah. Well, and I'm a layperson, so to me, it didn't sound chiropractic in a sense until I actually experienced and said, well, this is very complementary to chiropractic and what chiropractic does. But for the doctors out there that maybe haven't experienced shockwave, or maybe they don't lend themselves in professional, life to supportive procedures, what would you say, as from doctor to doctor about that particular service?
Yeah. Shock us about Shockwave.
Yeah. So it's a similar, approach even with patients, Paul, because I don't care for the name too much. So I have to explain to them that I'm not actually going to be shocking you from the perspective of an electrostimulation. So it's acoustic. So it uses a sound wave that because it's air, but it's a really high pressure. Now the other form that a lot of people think of is ultrasound, which was part of the training for a lot of chiropractors, which again uses a sound wave to penetrate the body. But that's a very high frequency and it's a very low pressure. In fact, you don't really feel it. The only thing you might feel is some warming. But with shockwave, and other names of it include extracorporeal shockwave therapy, um, pulsed activation technology, but it's kind of the little brother of something called lithotripsy. So lithotripsy is something that's used in medical clinics where they introduce a very high pressure acoustic wave pattern outside the body to blast away kidney stones. And so it's using a real high pressure, and its intent is to literally blast away kidney stones. But it's kind of brought down to a level. And if you think about all of the physical agents, all the modalities that we use in chiropractic, they're on a little different level than we might see in some of these other areas. And this one's no different, where it's not intended to destroy anything. It's intended to use this form of energy to really communicate with the body and help it produce what it's supposed to produce, which means that, if there is some healing that needs to be done, it stimulates the body and assists that process usually. And it's one of the few things that we can say goes above and beyond the call, right? Like it goes down to the level of assisting in producing even stem cells. So where's its application? Initially, it was thought of because it was destructive in lithotripsy. We must be using it to do really, bad things or for bad things like these chronic conditions. And it doesn't need to be, to that extent, but what it does is it allows to assist the body and really promote healing. And if you think about what I just said, that's kind of what chiropractors signed up for, which is to really assist the body, right? And I don't care where you graduated from, we all talked about innate, and there's something inside of us that wants to live, right? And so we are assisting the body in doing what it's supposed to do. It's a good nudge because it gets deep. It's a form of energy that can penetrate really deep and get at that cellular level that is really challenging to accomplish with sort of any other approach.
If I could ask, just to keep it on a fundamental level, what are the conditions you see that are most responsive?
So it started its life really in calcific tendinitis of the shoulder because again, sort of lithotripsy, blasting, calcification, blasting. And we know that that's not true. In other words, we're not destructive at all. What it does is it causes the body to create resorption of that calcification. So in our world, what I think is why I got so excited about it is some of the limitations of really getting in deep, really getting to that cellular level. And so it can help restore and help with nerve regeneration, peripheral nerve regeneration. It's actually what we say is sparing of tissue. It can halt further damage to other tissue of the neurological tissue, the muscle tissue, the cartilage tissue, even bone tissue, and has an excitatory effect to growing new tissue. So it minimizes scar tissue formation and promotes the production of things like new stem cells, so adipose and mesenchymal stem cells. So it's really good at assisting with that healing process that otherwise might have been stalled. So we initially used it a lot for these chronic things. So when I think, why my low back pain patients, and let's face it, we're pretty good at dealing with those. But I can probably get them a little bit higher, a little bit faster, and a little bit
Most
sooner as a
stable.
result of that. And it doesn't replace these. I've never ever said it takes place of this, or that's my heart. So
Hmm.
I still focus and tell people, Mike, listen, you are still at the heart of all of this. That's just an extension of what you're doing.
Thank you.
Cool.
Excellent.
So on the flip side of that, Jacob, I'm thinking, because again, I'm not the clinician, so I kind of zone out a little. No offense, docs, but um,
Right.
I think about it from the other end because I started as a chiropractic assistant. When something came in, all of a sudden I've got this device, and the doctor's like, "Hey, you're going to help us with this," and they don't tell me the whole workshop in the 6 or 8 hours that they were just in a class. So for
Press this
you,
button.
yeah, you walking in, what do you see as the challenges and the advantages of something like Shockwave coming in? Like, how long does it take to like get that thing received and going?
Yeah. So advantages, there's certainly a lot of advantages. I mean, first and foremost, it's the clinical outcomes. I mean, if you look at all of the up-to-date literature on this, it's simply one of the best tools that we can use in practice for, a lot of the stuff that Dr. Proulx just highlighted, right? Calcifications, chronic tendinopathies, chronic pain, etc. So that's first and foremost. If it didn't give good outcomes, it wouldn't have legs underneath it. When talking the business side of things, though, treatment time is a big one. An average treatment, a few minutes, right? Obviously, it depends the size of the area, but I mean, it ranges from a few minutes up to maybe 10 minutes, right? But when looking at treating like a lateral epicondylitis, I mean, you can literally knock that thing out in a few minutes. So speed and time is huge because, as you know, time is money, and we don't got no time any day anymore nowadays, right?
Well, and like in Maine, just like Massachusetts, in a lot of jurisdictions, assistants can actually apply this stuff. So if they're taught
Correct.
and properly trained, then
Yep.
boom,
So
Wait, say that part again, Paul.
taught,
Properly
properly trained. Yeah.
trained.
Yeah.
and I was gonna get into that. So
Yeah.
that's one of the areas that's been tricky about Shockwave. As any product that gets popular in the market, more people come out with new ones, and now we are flooded with a million different brands, styles, models. There's a lot of mismarketing out there in the industry, which is unfortunate. And even more unfortunate is there is a clear lack of training and standardization in protocols. So that's where we come in and really help these clinics. If you don't know how to use the thing properly, you're not going to get the good outcomes, and then you're not going to generate revenue, right? I mean,
All right,
that's
but
at the
is it like
backbone of
this,
everything.
here's the box, click on this video, have a nice day, or is there actually like, um
So if you want to be good at it, you do need some actual good, time invested into the training of it.
Yeah.
A lot of the devices are pretty easy. Like one of my favorites is the device made by MedRay. So it's as easy as it gets. Presets broken up by body regions. You click a few buttons, and you're off to the races. You put the applicator on the injury, and there you go. Um, but like anything, to fine tune your craft, you want to put a little bit more behind it than that. And by doing that and becoming a so-called expert of it, that's gonna be what separates your practice from the one down the road that also has it, because people will notice.
Kind of the goal of our upcoming
Yeah.
workshop is to make sure people know how to work the device, not just have the theory behind it, but actually have their hands on a piece of equipment and use it.
Yeah,
Yeah.
there's
It'll
just
let
a
them.
lot. The amount of offices that I go into, I travel all over New England in person, and I do virtual trainings all over the country. And the amount of offices that tried one piece of equipment and didn't have success, and then they bash the technology, and then we come in and we're like, well, let's try this one, or just keep that piece of equipment. How about we tweak this and that? And it's a totally different outcome. So unfortunately, like any piece of new shiny technology that releases, there's some bad advice that's going around, some bad protocols. So we're trying to do mop up duty and
Yeah.
clean
It's
that up
kind of
a
the
little bit
same.
for
It's
people.
probably the same doctor that will ask you to come back 20 times because one adjustment won't work.
That's right.
Yeah. So, maybe you could shed a little light on a class 4 laser for us too.
Oh, look at that pun. Oh my gosh. Stand back.
Wasn't intended.
Oh, I think it was. Yeah, so Dr. Proulx, part of the workshop, and we'll get into the workshop specifics in a second, is the high powered or class 4 laser. Um, Quick synopsis of that. What's the difference between, class 4 and the other lasers that are out there?
So yeah, there's the FDA kind of separates a class 3B laser to anything less than 500 milliwatts, and then a class 4 laser high. So some people use that term high power laser or high intensity laser therapy synonymous with class 4. Not always the case. So, basically from a half a watt to, where we're at today with today's technology, and in particular pushing, say, 45 watts, is a far cry from our class 3B laser or a lower level class 4 laser. So high intensity laser, it allows us to really capitalize on, I would say, technology. So photobiomodulation occurs as a result of light, and it can be low intensity, it can be high intensity. But the higher power lasers, the high intensity lasers, allows us to capitalize on the longer wavelengths, allows us to capitalize on time, movement capabilities, and again, um, taking photobiomodulation really up to that next level.
So
Nice.
what's exciting, and first of all, I have to thank both of you guys. Jacob, thank you for, basically getting the equipment in for our March 13th class on a Friday. And Dr. Chris, thank you so much for, basically heeding our call, which is we want the doctors in this workshop style doing it as they learn versus listening and then dabbling in it. As Jacob said, the more you use it, right, the better you're going to get. So huge thank you for that, because we're excited to host the class. And obviously your expertise, Dr. Proulx, is really desired. And Jacob, you having expertise in the particular equipment as well, The workshop also, I think, which is really cool, is you're going to integrate both the class 4, right, and the Shockwave, so that they're going to learn both of those things and how maybe they benefit working both at the same time with the adjustment.
Right. And that's what I was about to allude to a little bit earlier. So that's where, there's still a difference between the clinician and the assistant. The assistant is following the guidelines of the clinician, and the clinician's job is still to figure out, where do all the pieces of this puzzle fit? And that's really a big part of the focus. I mean, obviously, yep, we're going to talk about protocols and some of the background, but how do we integrate it and how do we implement it within a protocol scheme? So we're not asking, people to change the way that they've been doing things for 30 years completely anyway. But more so, what can we do better? And how does it again really complement where I've already been successful, which is these and this and this, of course. And that's where that expertise comes in on the clinical side, but also on the business side of like, okay, so how do I talk to patients about this? How do I get their quote unquote buy-in if something's not covered by insurance, if that's the type of practice that you have? How do I talk to my staff? How do I make sure that we're all on the same page? How many visits do I do? Do I do it before or after decompression or the chiropractic adjustments? And so that's a big crux of what we're going to talk about and do. Also kind of a discussion, like we want to know, like, what is your practice and how does that work and how can we help you fit that in and implement it?
Well, isn't it true, though, when you think about it, that the laser and shockwave are really more sophisticated, advanced forms of things that we've been doing from the beginning? I mean, going way back, like you said, ultrasound. All right. So now we have a better ultrasound. I'm even going to go way back. And Paul, you can turn your mic off now. But even I remember the days where people used to put you under red lamps. Right. So are we really talking about?
Is that when you drove
way
your
more-
horse and buggy to work, Mark, or what?
You guys think it's easy, huh? You think it's easy. But aren't they really just more sophisticated, advanced forms of things that we've been doing? So when somebody starts saying, "Oh, well, no, this and no, it's all true," no, chiropractic has been using these modalities forever, literally forever.
Well, and we can even direct some of the founders, that were doing this stuff even before some of these other practitioners. And I like the way you brought that up, Dr. Mark, because, it's more of an extension. And I think what sometimes people maybe fail to recognize is that there is potential, innovation even in something that otherwise, started with just utilizing our hands in 1895, and that it potentially allows us to do a little bit better, but really kind of expand. Like, now I don't want to get into a debate of whether or not everyone would benefit from, spinal chiropractic adjustment. My feeling is they do, but to specifically address maybe plantar fasciitis, there might be some other aspects of that condition that really need additional supportive care, and that allows us to, when we talked about what happened with COVID, and I was giving I was speaking at an event in Virginia soon after we were all finally able to get back to work, and I was talking to some of the folks that I had known and I had worked with in the past, and I'm like, I don't know, are you guys busier than ever? And they're like, yeah, because we were one of the few people that were open during that time.
Right.
And people that normally were not referring to us were referring to us because it was the only option, and not that you want to succumb to that, but I'll take it.
And don't you think that in today's marketplace, and Jacob, you could even speak to this a little bit, but I feel patients expect us to be broader in our approach to their care and be able to treat more conditions outside of spinal related symptoms and keeping them well through the adjustments. But they do expect us to look at their feet and look at their hands and their wrists and everything else, the shoulders.
100%. I mean, integrative medicine is on the rise throughout the whole country. So, in patients, when they find a provider that they like, they want to come back to you. And I mean, you guys know that, like, chiropractors are some of the best clinicians at that, right? Like, you treat patients well, and they're patients for life, they're friends for life, and they want to come to you for as many things that you can treat them for. So if you integrate a new technology that makes it so you can now treat more conditions, great. That's better for patient retention. It's also better for your business bottom line. Like, you're integrating a new revenue stream on the business side of things, right? And
Yeah.
and patients like the new shiny toys.
I
They
was
they
gonna
do.
say
It's
they like to know your state of the art. They do. They
100%.
absolutely do.
And it shows that you're open-minded to new innovations,
Yeah,
right?
and
Like,
even like
if
Dr. Proulx said,
that's
nothing's more sophisticated than these, but patients have their own perceptions for sure.
100%. And I mean, business 101 is you got to be able to pivot, adapt, and always keep your eye over the horizon for what's new. If you don't, then you'll fall behind.
There you
So,
go.
question for both of you though. Do you ever find challenges with provider offices or providers that they're in their, I'll say, patterns or habits of practice? Then you bring in this, or they bring in this tool or tools, but you have to sort of like bust through the concrete of their pattern or habit to get them to utilize, the new device, the new service. Do you ever see that as challenges?
Changing human habits is one of the hardest parts of my job. Talk about how to do that every single day, Paul.
That's the shock and shockwave, right? Yeah.
Hmm.
Yeah,
Yeah.
exactly. Sometimes we'll do that on the head. But the thing is, like, that it's known too, because there's fear in adopting something new that you weren't necessarily educated in. There's fear in changing the way that you do things. Um, and there's that resistance to change, in behavior modification. And so we have to overcome them. And where, and Jacob will do this a lot more than I do, but figure out where that resistance is. Because if it's clinical, then yeah, that's my job, and I can figure that out. But if it's, gosh, am I making a mistake if I add this in? Is it going to bankrupt me? Are my patients going to like it? How is it going to impact, my bottom line? Is it good for my staff? Are they going to, want to do it, and things like that?
You
Yeah,
know, I
one of the
find that
biggest hurdles that I come across is usually practices that have not utilized a cash service modality before. If that is a new concept to them, that is always the biggest hurdle. And again, that's where proper training and some resources come into play, right? Where, like, we don't only just sell you the equipment and it shows up and we say, hey, good luck, press a couple buttons and press go. Like, we're coaching them on how to implement, how to build it properly. That's important. And how to market it. Like Dr. Prue said, when to use it in your day to day, right? There's a lot of different aspects to implementing a new service that go beyond just, this is how you use it. You press a couple buttons on the presets and off you go.
well, it comes out to be like every self-paced service that somebody offers in an off that gives, offers them through their office is it has to be a perceived value. So along with just teaching the doctor, you have to have them learn. They have to believe it, just like those that have all self-pay adjustment practices, because they have such faith and belief in the adjustment, they have no problems transmitting that faith and belief to a patient. So if I'm gonna go out and buy a piece of equipment and think that all I have to do is go, "Ta-da! Here it is," no, they have to have that
Mhm.
same faith and belief in the equipment, and that's where you guys come in.
100%.
Yeah. And that's, it's a multi-tier similar process where we want them to be successful, so they're successful with their patients. So utilization is really important. And I was just in a recent meeting with another physician, and he's just like, wow, he's like, the success that we've seen is just, how do we tell more people? I'm like, we're trying. And I said, I wish it happened that quickly, but it takes time, and that's where, you can break down the marketing, the different levels of adoption and things like that.
Well, I'm looking forward to you teaching me new tricks.
All right, here comes
Paul,
the
I softball that one to you, you know?
here comes the shameless plug. So, Dr. Proulx and Jacob, and MedCor professionals, you guys are going to be at the 4 Points Sheridan Norwood in Norwood, Massachusetts. This is Friday, March 13th from 9 to 4. This is a full day, 6 continuing education units on laser and shockwave. The registration includes lunch as well as morning and afternoon snacks. It's an awesome location, a great venue. Tools of Practice is hosting it for MedCor and MedRay and Dr. Proulx and Jacob. I can't emphasize enough that this is not your typical CEU class because they have embraced our request and are looking forward to, and I think going to have fun with this workshop concept where we're digging in, getting to get on the equipment and learning along the way. So you start to really get comfortable. I mean, that's the whole point, right? Is getting comfortable with something new, or maybe they already have one in their office. I don't know. And they just don't know how to use it, or they don't know if the
Then
one
bring
they're
your
using is
staff.
the right
Yeah.
one. Yeah. Bring your staff too.
Have
Yeah,
them
exactly.
train. Yeah.
Yeah. So that is Friday, March 13th.
The 13th, Friday, the 13th.
Yeah. Yeah. I know. What a good day that is.
Yeah.
Perfect.
Is that unlucky or?
Yeah.
So if I show up in a hockey mask, you'll know why.
So you can find out more and read the details at toolsofpractice.com. Go to the seminar tab and you'll read all about it. You can register there. Members, obviously, our Tools of Practice members get $50 off. And if you want to reach Jacob to find out more, or to reach Dr. Proulx, you can go on that page and you'll get to them through the click-throughs. Anyway, guys, we could sit here all day and talk about it, but the whole point is to have this awesome class so that we can dig in and talk about it around the machines and during the machines and utilizing these techniques.
You'll have all day to talk about it.
Yeah, we will.
Well, and kudos to Tools of Practice because, just an amazing group to work with. The way that things are put together, and kudos to 4 Point Sheridan because the food is really good.
It's really good.
Good job.
It is. Thank you.
Yeah.
So if that's the only thing you get out of it, let me tell you.
Well, we'll be there.
Exactly.
Awesome, guys. Well, thank you. Thank you Thank you for taking the time today too. We appreciate that. And so with that,
absolutely.
Thank you again for listening to another episode of All Things Chiropractic. I'm Paul Andrews.
And I'm Dr. Mark Davini.
Thanks, guys.
Thanks, guys.
Thank you.
Thanks for listening to All Things Chiropractic. We'd love to hear from you. Visit allthingschiropractic.com with comments, episode ideas, or questions. Or connect with us on Facebook and Instagram at All Things Chiropractic Podcast. Be sure to join Dr. Mark Davini and Paul Andrews next time for another episode of All Things Chiropractic.